Hey everybody, welcome. Today we're talking about, can fibroids cause bleeding during pregnancy? I'm Dr. Perkins, a board-certified OBGYN, and I love talking about things like this, and so I'm glad that you're here, so let's talk today. So you should watch this because we're going to talk about fibroids, what they are, how they can cause bleeding during pregnancy. We'll talk about when is bleeding a cause for concern during your pregnancy. We'll talk about the risks that are associated with fibroids in pregnancy, and we'll talk about bleeding in the 4th trimester. And if you hang around till the end of this video, I have a special free gift to offer you, so you don't want to miss this, all right? Come on in. All right, so fibroids are really extremely common. If you are female, if you are in your reproductive years, which are the years between puberty and menopause, the likelihood of having fibroids is extremely high. And some reports show that it could be as high as 70% of us will have fibroids. And so you may be a little bit overwhelmed right now because you might have just gotten a diagnosis, or maybe you've known about these fibroids for some time, but you'd like to know, could they be causing or could they cause bleeding during pregnancy? Know that not all fibroids are created equal. In fact, depending on where your fibroids are inside of your uterus will determine whether or not you could potentially have bleeding from them. So for instance, there are 4 types of fibroids inside of your uterus. And so really, there are 3 layers of your uterus, but 4 places that they can be located. So let's talk about them. You may have fibroids, which are called submucosal fibroids on the inside part of your uterus. That's the space that normally creates your periods. That's the space that blood tends to be in abundance because that's an area of growth. That's an area that if there's a baby there, we want as much blood flow as possible to your baby. And so that area is filled with blood, the possibility of more blood, and lots of vessels. If you do have fibroids in that area, the likelihood of bleeding happening in your pregnancy is much higher. The likelihood of having a miscarriage is also much higher because, again, that's an area where pregnancy should develop. And so if there's a fibroid there, the fibroid can compete with all the nutrients and everything that a growing pregnancy would need right locally in that space. So that's location number 1. The next location is that you may have fibroids that are located in the actual muscles of the uterus. And so those fibroids can cause you a little bit of pain. They may also sometimes cause some bleeding if they are large enough to stretch into the inner space as well. So think about this. We have the muscles here, and the muscles are probably pretty similar to the size of your muscles when you're not pregnant. These muscles then grow and grow and grow and stretch with a growing pregnancy. And so especially in the beginning, when the uterus is much smaller, if you do have fibroids in the muscular layer, they may impinge or push into that space much easily. And anything that touches that inside space of your uterus may cause bleeding. You can also have fibroids on the outer parts of your uterus. And those kind of fibroids are so far away from that inner space of the uterus where bleeding comes from, that they don't cause bleeding themselves. Those fibroids are literally the least problematic to your growing pregnancy. There are always exceptions to the rule, like for instance, if they're on the outer part of the uterus, but they're on the outer lower part of the uterus next to your bladder, they may cause problems, right? But if they're on the top, if they're on the back portions, usually your pregnancy won't be affected by those fibroids. Now, I mentioned that there were 4 types of fibroids, right, in 3 different locations. So you might be saying, well, Dr. P, you mentioned 3 locations already and 3 types of fibroids. What is this 4th or final type of fibroid? Well, sometimes fibroids can hang off of your uterus, like literally like a stalk, like a fruit, and hang in the spaces of your pelvis, hang off the top. And those fibroids are even less problematic than any of the others that I mentioned. And so, in the order of importance, what I want you to take away from what we're talking about right now is that the closer your fibroids are to that inner space of the uterus, the more problematic they are, and the likelihood of bleeding is higher. The further away they are, the least problematic they are. In pregnancy, you can always have spotting, especially in the first trimester. This is usually due to implantation bleed. Now, I've had patients say to me all the time that, Dr. Perkins, I had a period, I didn't know I was pregnant, I was 6 or 7 or 8 weeks pregnant. The bleeding you have may resemble a period, but if you are pregnant, you cannot have periods. And so if you are having bleeding, that is abnormal bleeding. And so a majority of those bleeding periods, or moments of bleeding, I should say, are due to the pregnancy itself working to establish itself and implant itself inside of your uterus, which is where it will call home for the next 32, 33 weeks. That may be a little bit disturbing, and really it truly should be. If you're in your first trimester and you're having any kind of bleeding, which should be more so on the side of spotting, but definitely if you have heavy bleeding, and it's important that you see your healthcare provider right away. And if you can't make it to your provider, then now you're going to the emergency room or the emergency department so you can get help right away. So now we know that yes, fibroids can cause bleeding during pregnancy. We also know that if you do have bleeding, that you should contact your provider right away. Some of the issues could be that bleeding can lead to a miscarriage. If you're further on in pregnancy, like in your second or third trimester, then bleeding can cause your placenta to prematurely separate from the uterus in what is called a placental abruption. Now, there are so many other reasons why you could have bleeding in pregnancy, and fibroids could be one of them, because there are so many other things like placenta previa, for instance, that can cause bleeding. It's important that you are really working with your providers and talking with them so you can know whether or not the bleeding is due to the fibroids or to something else. One way that we check for these is to do an ultrasound. That's very common. We call them sonos and sonograms, or an ultrasound. But either way is an ultrasound visualization of the state of your pelvis, your uterus, your pregnancy. And so ultrasounds give us a good picture of what's happening on the inside. We're able to look at the placenta to see if it's having an abruption. We're able to measure the fibroids and check to make sure that they're not impacting or affecting your baby in any way. We're able to visualize the uterus and the ovaries and everything in between. And so getting regular ultrasounds is super, super important to help you go through pregnancy as smoothly as possible. Now, if you are having bleeding and we've determined that the bleeding is due to the fibroids, your doctor may recommend certain things. Of course, keeping your hydration up pretty high. During pregnancy, you should have somewhere between 10 to 12 bottles of water per day. And so, especially if you're having issues with bleeding, we really want to keep up with that amount of hydration every day. But also, your doctor may give you pain medications to help you during pregnancy to kind of make it through the best way you can. Of course, you can try Tylenol or acetaminophen. This you can find over the counter, and most of us have it somewhere in our bathroom cabinets. And so if that's the case, we know that Tylenol is safe in pregnancy, or one of the safest options that we have in pregnancy to help with pain. And so we can try that. Another thing that you can try is using something called a pregnancy belt. This is a contraption, I would say. It is a belt, like literal belt that goes around your waist, and it helps to relieve the pressures that could be caused by your fibroids and your growing baby and the pains that comes with that. You may try that as well to see if it helps with your pain. You can also try anything warm. So this could be a warm compress, this could be a heating pad, this could be a warm shower to kind of help with the pains as well. And so while we would love to have way more options, this is the best that we have to help you throughout pregnancy. And you may be wondering, well, that may help with the pain, but what about the bleeding? If your bleeding is due to these fibroids, we're not able to take out the fibroids during pregnancy. It's not recommended to take out the fibroids at the point of delivery. And it's definitely not recommended to remove them in the 4th trimester, which is a time frame after you give birth and leading up to the first 12 weeks postpartum. And so during that time frame, all of that time frame, you may have bleeding, but we are in a state where it is unsafe to remove these fibroids or physically do anything aggressively to take care of them as well. Now, I'd like you to also know that in this 4th trimester, it is very common that you can have spontaneous bleeding due to fibroids. And so if you are pregnant currently, just know that delivering your baby healthily is the number one goal. You doing well postpartum is also important, and bleeding can happen spontaneously at any time in the first 6 weeks after you deliver your baby. And that's regardless of the mode of delivery, whether it's a vaginal delivery or a C-section. And so with that, even if you're at home right now, after you delivered your baby, if you're having heavy bleeding at any point, it's important that you talk to your provider and let them know so that you don't have a form of hemorrhaging or heavy bleeding in this time frame. I hope this makes sense, and I'm excited that we've talked about this topic today, and I'm more excited to offer you this free gift that I mentioned in the beginning. And so it's time for you to get that free gift today. Listen, I'm offering you a free copy of my ebook, Hormones Don't Lie. Because guess what? Hormones are the root cause of fibroids, fibroids that are growing, fibroids that are multiplying, fibroids that are causing possible complications during pregnancy, and even after you deliver your baby. There are things that you can do to help your hormonal state and therefore help your fibroids. And that is what you'll find out in this ebook, Hormones Don't Lie. So grab your free copy. The way that you do that is by clicking the link below in the description area, and I'll send that right over to you almost immediately. I hope you've learned a lot today. This is a sensitive topic. If you are currently pregnant, I wish you well in your pregnancy. I wish that you would talk with your providers and have a good delivery plan, because while bleeding can happen, you can have a normal pregnancy just fine. And so I'm here to share that with you today. I'm Dr. Perkins, I'm board certified OBGYN, and it has been wonderful talking with you about this such a sensitive topic today. Thank you for being here. Take care.